Yes, good afternoon, class. My name is Max Eckerson, and this is for Liberty University online for my class COUC 521. And this is my fourth discussion board post. And I will be discussing about the 2004 ACA Code of Ethics as approved by the ACA Governing Council. And what I'm going to be discussing is the different surprises of maybe that I had on the Code of Ethics, as well as anything missing that I feel like could be beneficial for counselors. So the first code of ethics is E1B, counselors not misusing data from the assessments, and then also taking the responsibility for others that I am supervising that might be misusing the data and making sure that they do not. So this also, I believe, comes to just like an ethical standard that counselors must have that are held to a higher standard. So making sure that we do not misinformation purposely or even by accident misusing the data that or the information that it was actually created for. The assessments could be created for one population, but we're using it for another. And because of that, we could be not having the correct information, as well as making sure that those are under us have the correct supervision and that we are training them appropriately and they are not misusing the information. E2A, counselors only using testing assessments trained that and that they are competent in, as well as making sure that if we are supervising anyone that they are competent and well trained in the assessments that they are currently using. So I also believe that this is an ethical standard that as counselors we are held to, of making sure that we are using the assessment correctly, we understand the data, and so that we can give the best diagnosis possible, as well as training those that we are supervising to do the same. And then E5A, the proper diagnosis of the mental disorders. E5C, historical and social procedures of the diagnosis of pathology. Another code of ethics is E5D, and this was one that was more surprising to me, because through the study of this class and others, one of the reasons that we use assessments and testing is to create a diagnosis so that we can best help our clients. But E5D says refraining from a diagnosis. And I was a little perplexed by that and a little taken off guard, but when I read it, it made more sense, like the full code of ethics. So what it discusses is from refraining a diagnosis if the counselor believes that it would possibly cause harm to the patient or others. And so with this, it makes sense that if we are doing an assessment and the data that I find out for my patient would create more harm for them, it might be the better idea to refrain from giving them a diagnosis, but continually treat them, and possibly if it's going to harm others. And so as a counselor, that's also an ethical standard that we must have, that we always do what is best for our patients. E7B, I think is important, is that is to create a safe environment for the assessment to be taken, as well as for the client to make sure that they are feeling comfortable in the environment. E9B, do not use the instrument with insufficient empirical data. Then E13A, this is something that I've kind of briefed over through different classes, but it's the forensic evaluation and evaluation of legal proceedings. This is something that I haven't fully studied just because it hasn't been pertinent to my studies quite yet, but I know I will be in the future having a better understanding that there's going to be moments and cases that I will be called upon as a counselor to bring that information, to bring the data through assessments to help them and to help the client. So this is something that I feel like is something important that I need to continually learn about. And then the last code of ethics, which is E11A, which for me that I feel it could maybe be improved a little bit, it says do not use obsolete assessments and outdated results, which I totally agree with, in that there's always updated data, so we need to always be, as a counselor, understanding that. But I think that what could be improved is the continuing education in this field. Maybe it is at different conferences, or I did not see in the Code of Ethics that it's something that they require or encourage, but to be encouraged to have the continuing education for counselors to always be updated on the most recent data of assessments, maybe not using outdated assessments that once was used for different diagnoses of certain mental disorders or disorders of all kinds, and just being well informed of the data as well as the understanding of the assessment and the proper use of it. So thank you so much for listening. I wish all that you guys have a great rest of your summer and a great rest of your semester. Thank you so much.